Oh, I like that. That's great. Good morning. I think we're ready to get started here. Appreciate all of you being here today. It's really exciting to see how many of you showed up, and I'm pleased to have you here and interested in this exciting opportunity that we're excited to be getting underway. As most of you know, the Kansas Health Foundation for many years has been focused on efforts at strengthening communities because we know that healthy communities make healthy people. Through our funding and technical assistance, we lift up our partners all over the state in an effort to leverage resources, build collaborative action teams, and implement creative and innovative solutions to improve health. But while significant health improvements have been achieved, there are still tremendous differences in health outcomes for many people in our state, which is often the result of circumstances in which people are born, grow up, live, and work, as I'm sure many of you know. There are also significant health disparities for many underserved or at-risk groups. Many studies suggest that zip code of residence, educational level, household income, racial and ethnic background adversely affect health outcomes. For example, in Kansas, while Kansas has the 7th highest obesity rate in the nation at 34.2%, which is something we're certainly not proud of, data shows that African Americans in Kansas have even higher rates of obesity at 45.6%. Isn't that alarming? And Hispanic people at 39.7%. While on average 17.7% of Kansans smoke, data shows that 30.4% of Kansans without a high school diploma smoke. And the rate is 32.2% for Kansans who have income levels of less than $25,000. We also know that 1 in 7 Kansans struggle to have enough food to eat, and that nearly 50% of the children in our Kansas schools, public schools, are now eligible for free and reduced lunch, and many Kansas children in urban school districts have even higher rates. In fact, in the Wichita public schools, our rates are somewhere around 80% of free and reduced lunch. This data has helped us to focus our work and efforts to reduce these health disparities and improve health equity. As we seek our partnerships to increase access to care, promote physical activity, decrease tobacco use, and improve access to healthy food, we realize that we must also build capacity for groups and communities to focus their efforts in these areas. We saw significant progress in our initial Healthy Communities initiative, where we worked with 20 communities in to address their respective health needs and owning the solutions to address health needs in their communities. This new initiative that we're kicking off here today, we hope to work with communities to focus their efforts around health equity needs in their communities by creating a network of health advocates focused on improving the health of people in Kansas who experience particularly poor health outcomes at greater rates. We are really glad that you're all here today and are interested in this opportunity to partner with us to improve the health of your community. We are really excited to get this effort underway. Best of luck to each of you as you move through the grant writing progress. We can't wait to see your proposals. With that, I'll turn it over to Jeff Usher, our Senior Program Officer, who is heading up this initiative. Thank you again for being here.
Thank you, Steve. As Steve mentioned, I'm Jeff Usher. I'm the Senior Program Officer here at the Kansas Health Foundation, and I've been working on the Healthy Communities Initiative for the last 6 years. We started in 2011. Today, what I'm going to do is basically provide a history of the HCI. I know some of you will be bored because I see some of our community partners out there today. But bear with me. We also have some folks that are watching us, watching me, I guess. Hope there's not a shine there. Watching on a webinar, which we will archive and have available if folks here want to share the information here with any of your colleagues and feel free to spread the word about that. So we're going to talk about the history of the Healthy Communities work that we've done today. Steve gave you a brief synopsis there. We'll describe this particular initiative and provide an overview of the application process, and then give plenty of time to answer questions. So as Steve said, we started with we were working with 20 communities starting in December of 2011. We started out with 12, and we had we had fantastic applications, and the review committee really struggled with making decisions on that. And so, and as we launched our Healthy Community work, there was a lot of excitement here at the foundation with our partners and our board. So we rather quickly hurried up and offered another round and funded another round of 8 communities in 2013. The total investment over that the 6-year period has been a little over $6 million, and it ends in April of this year. So here are the 20 communities, and I would urge you, if you are from one of these communities, to either ask me or connect with the leadership teams there that are currently doing good work, or have been doing good work and continue to do good work in Kansas around policies, especially around healthy eating and active living. And I'll go a little bit deeper into that. But so the HCI, our teams, our current teams, so this is part of the history, is we had the community leadership teams. So we really tried to work hard with these communities on building leadership teams in communities that were cross-sectorial or multi-sectorial leadership teams who had influence or were even policymakers who could influence policy at the local level. And the Kansas Health Foundation, we at the Kansas Health, we supported the work that is really centered around what we called the community change framework, which was an advocacy framework to help make progress on policy priorities in these communities. We had the technical assistance team that provided ongoing technical assistance and coaching for each of the leadership teams, and that is the Community Engagement Institute at Wichita State. They did facilitation and coaching, and they're here today. Many of them are here today as our current partners in this initiative. Also the Public Health Law Center, who provided policy expertise. Once communities identified their policy priorities and were beginning to make progress, they were able to analyze local policies and make recommendations on appropriate policies at the local level in Kansas. And then our other partner is Innovation Network, helping us evaluate this initiative. So what we asked our healthy communities to do is to focus on a policy priority that was really focused on either healthy eating or active living. And that really did cause some consternation amongst some folks, because there's all kinds of policies that we should work with. There's all kinds of issues we should work with around healthy eating and active living. But what we said is our experience has been, if we gather people around nutrition and physical activity and say, work it, what they often do is they do all the program work. It's, let's educate people, let's do the things that are, I mean, it's hard to do, but it's also, it avoids actually engaging a broader system and making change at the local level. So what we wanted to do was get people to focus on a policy priority with the idea that that would help them exercise that policy muscle at the local level. Our assumption was that if we were successful at helping communities make progress on a policy priority, that they would make policy solutions on a variety, and we've seen that happen in all of our communities that we're working with. So some of the areas that they focus on is food policy councils, healthy foods and public venues, healthy concessions, land banking and for community agriculture. And then most of the active living work is really around active transportations, either around schools, looking at complete streets policies, and then also focused on both bicycle pedestrian advisory committees or bicycle pedestrian plans at the local level. So at the time we were working, we had our healthy living funding area, and we had a logic model for that, and we were really and we were making success at that. But during this process, over the last 6 years, the foundation decided we really needed to look at our strategic plan. And during this process, our board and the staff came up with a new strategic plan. And here's our strategic focus. And we have our vision now, which is the Kansas Health Foundation envisions a culture in which every Kansan can make healthy choices where they live, work, and play. And so we had 2 chunks of funding that we see, and one is health equity and the other is civic health. The focus on this work is going to be health equity. But I can tell you, as we progress through this work, we will see those communities funded actually being very engaged in the civic health arena. So clearly around the civic health, the health equity piece, we focus on the social determinants of health, the prevention work. A lot of the prevention work is very similar to the prevention work we did with healthy eating, active living, but there may be other areas in which communities might work in. And then access to care has always been a very important piece for us. We still are very engaged in trying to make sure that everyone has access to health care in Kansas. On our civic health arena, we fund a lot about actionable data, and our partners at Kansas Health Institute, who we provide operating funds to, they do that. They're nonpartisan, but they offer great information for policymakers at the state level and at the local community level. And then media and journalism. We know that media is very important in educating the public, and we need a strong media. So we have funded at one time it was KHI, the Health News Service is now transferred over to KCUR, but we are currently actively making sure that we have regular media talking about health issues in Kansas. And I'm sure if you listen to NPR, you've heard some of that. And then leadership. And right here, you're sitting in the Kansas Leadership Center, which was when I first interviewed here at the foundation. That was over 19 years ago. Steve Cohen said that we have a dream to create a leadership center here in Kansas to help communities and the state wrestle with those difficult issues and make progress on issues that affect the health of all Kansans. So that's kind of our new framework. So over a year ago, when we announced this, we started working with our healthy communities to really think about how they might put a health equity lens on their work. And so that's how, and then the team here at the foundation, our partners throughout the state, and others helped inform the foundation on this particular initiative that we're rolling out today. And it's focused on health equity. And hopefully by the end of today, you'll get a clear understanding of what we mean by focusing on health equity. So really and Steve kind of, he actually mentioned this, but I want to make sure we emphasize a couple things. The health equity, the purpose of this initiative is to support leadership teams in cities, counties, and or regions in Kansas to engage in advocacy efforts that will improve the health of people in Kansas experiencing poor health outcomes, and create a network of community health advocates willing to learn and discover how to efficiently impact the health of Kansans using a health equity lens. So you see that there are 4 areas that are highlighted there. Leadership teams, that's a key. So we see that multi-sector leadership teams helps with really moving public policy. So, and we've spent 6 years trying to build the capacity of communities to develop these leadership teams, and we would like to see that work continue. And it's also, I might add, this isn't new. This is the CDC defines this as a best practice. I think most funders that are working in healthy community work recognize this and try to build those efforts in Kansas and across the nation. And then the advocacy efforts is highlighted as well. So in order to make progress on the work that will emerge here, it will require people advocating around those strategies and priorities that emerge from engaging communities suffering from health inequities. And then learn and discover. This is an important one because what we're going to do in this experience, and we learned this from one of our fellows classes, which we have a fellow right here who was part of that. The 20 folks that we hope to engage that are hired in the 20 communities, we will kind of work with them as a cohort, a learning cohort, along with the broader advisory committee and the technical assistance team. So they will be going through a leadership development experience together. We'll convene them regularly around learning and discovering. And then we want to then, and we'll continue to focus on a health equity lens. And hopefully throughout this presentation, you'll get an idea of how we intend to help the communities do that. So here's the opportunity, and I think if you've read the RFP, it's probably pretty clear, but it's going to be a competitive request for proposals. We'll fund up to 20 communities. The communities will receive $75,000 a year for 3.5 years, or $262,500 up to, and that's up to 20 communities. And then you will receive ongoing technical assistance and be part of that learning community I just described on how to effectively impact the health of Kansas using the health equity lens. We're also going to be wrestling with how to engage other sectors at the community level, and we can talk about that a little bit later. So the goals of this is really around convening the cross-sectorial leadership team. So if there isn't one already in your community, you need to think about thinking about how you could build one. And so in your application, you could be talking about that. As I mentioned, if you saw on that list the 20 communities working, I would suggest that you at least connect and just have some contact with those leadership teams that are currently in place. Many of them are really very strong, and you'll have to be creative around how you will work with those leadership teams. And I'll talk a little bit more about it, and I think it probably will come out in the questions and answers. But thinking about strategies to really work with leadership teams to engage these populations suffering from health inequities. The other goal here is this is the important one, and I think this is the one that really puts the health equity lens on the work, and that is intentionally and authentically engaging populations experiencing from health inequities to develop a plan to improve the health of the population impacted and increase the capacity and influence of those targeted populations to improve their own health outcomes. And that's the key. So when we worked with our healthy communities before, we said, we want you to focus on a policy priority to build that policy muscle. In this case, it's focusing on a population in your community to build that health equity muscle. So it's another way of basically trying to drill down and focus on, with the assumption that these communities these healthy communities, the work that is doing around these coalitions across the state of Kansas, will become very comfortable at working with the health equity lens. And I think the key is engaging those populations and then giving them power and influence over the strategies that will impact them. And so that's where the technical assistance will help. But as you write your proposals, I would encourage you to think about how you're going to make an argument that you've figured out through data and working with others, how you've identified these populations, and then how you might engage those populations. If you already have a population you're going to have to make an argument about that you think you should work with, you're going to have to make that argument in your proposals that you have gone through a process that has been informed through data and engaged others regarding that population. If you have a solution, you're also going to have to demonstrate not only how you identified that population, but then how you engaged authentically with those populations to come up with that solution. And we can talk about that a little more, I'm sure, and more question and answers. And then once you've identified after the planning year, once you have identified this, you will then engage in a broad range of advocacy efforts to actually try to implement those strategies and priorities that those populations have identified. So the structure of this initiative is that the first year will be a planning year. So that year, the technical assistance team will help provide assistance on how you might identify those populations, and if you have already identified those populations, really how you authentically engage those populations. And we'll provide a number of tools in which to do that. As a result of the planning, of this planning, participating HCI leadership teams will submit an action plan on May 1st. So the plan will be submitted on May 1st that will increase understanding of the health inequities leading to the identified population chosen, strategies on how the leadership team will continue to authentically engage the affected communities post-planning year, and strategies on how the leadership team will support an affected community to engage civically and to identify policy, systems, and environmental interventions to address health inequity. So that's the basic structure. The expectations, we really want someone in your community who's going to be dedicated to this initiative. We're providing $75,000 a year, and that could pay for a full-time employee. But I would urge you to think about how you might be creative in doing that. We're going to require you to have a full-time person to be dedicated to this work, because we talked about the cohort, which we want, and so we'll probably be convening them quite frequently. But if you have someone in your community who already this is part of their work, this could pay for a portion of their salary, if that makes sense. So that way you would have additional dollars for convening, bringing in additional technical assistance, but we'll be okay. But you'll have to commit to having someone that'll be a full-time employee that will be dedicated to this work in your community. Have or begin planning to the development of strong cross-sectorial leadership team to help plan, engage, and implement this initiative in the community. As I mentioned earlier, if you don't have one, it's really important that you begin in your proposal thinking about how you've planned or how you might engage. So there may be an organization here that has a great deal of credibility with certain populations, and we do know that and it's part of the RFP itself. For instance, a leadership team. I hate to do this because I use Douglas County all the time, and they're here, but they received a grant from the CDC, and part of that grant, they actually Live Well Lawrence, which was an HCI community, actually brought in PolicyLink to help them think about how they can advance their work using a health equity lens. Chris, and Charlie, who are here today, they invited me because we had just announced our new strategic framework, and Chris said, you know, since you're looking at health equity, we're bringing in Policy Link. You're welcome to come to the meeting. So I came to the meeting and went through the training, and the team at Live Well Lawrence kind of wrestled with, okay, how do we do this now? And at the time, I made a suggestion that they actually use some of our HCI money to experiment with that. And so they did. And what they did is, and you can correct me because I tell this story, I'm sure it's gotten a little embellished. But what they did is I remember them wrestling with this. There's a neighborhood in Lawrence that suffers from food insecurity. And their priorities were around healthy eating. And so what they did is they knew they needed to engage this population. Then there was some discussion around folks that said, it's really hard to engage them. And so what they did, well, and on top of that, the planning, Lawrence Douglas County Planning, they were in the process of doing a comprehensive plan, and they were already tasked with adding a food plan to that. And so what they did is they approached an organization in their community who basically has credibility in that community, has a presence in that community, and they provided funds, not just our funds, but some additional funds from other sources to provide funds to this Sunrise project. And what they did is they hired people, young people in that neighborhood to actually help interview folks and make it part of the comprehensive plan, which it's complete right now, I understand, or at least a draft of it has been completed because I saw it. So that's just an example. So we have a leadership team that said, okay, we've identified a population suffering from food insecurities. It's very clear. And then they provided the resources to that organization to actually help do the work. So that's an example of how a leadership team might engage an organization that is credible in a community. And I think that's one of the things that we're going to have to wrestle with as a technical assistance team as we see proposals come in, because I'm sure we'll see proposals from people that are already very engaged in populations suffering from health inequities. We want to look at those critically, but we also we would love to fund some of those, but we do want to see the connection with a leadership team that is cross-sectorial, that has some influence in your community. Okay, that was just on that one point. The next, agree to a timely, okay, we got the leadership team again. Agree to a timely, we're going to be doing quarterly reports. It's going to be focused on what we did in the first round of HCI is we created what we called the community change framework, and that's just an advocacy framework. We structured all of our reporting around that framework. So it really focused on an advocacy effort. So they reported back to us how they are mobilizing the community. They reported back to us how they're engaging policymakers. They reported back to us how they're engaging or educating leaders in the community. Those were all part of their reporting process. We're going to be developing what we call a community engagement framework. And that will be focused on how you engage those populations. So it's going to be really focused on engagement at first. And then we'll kind of, we'll pivot once those communities are identified on how to really work to engage civically those communities so they can make progress on their work. And then we will be convening folks twice a year. We want 2 members of the leadership team and the community liaison to attend those, so that'll be an expectation. And grantees will be expected to participate in monthly technical assistance calls. And I might add, it always works better if it's not the community liaison who is the only person on the call. We also will, in the technical assistance team, will continue to work with the communities on this. Sometimes when people are hired to do work, there's a perception in the community that it's their work. but it's not. It's the leadership team and the community's work. So it's important to for the technical assistance providers to also be engaged with the leadership team and those also who are being identified as the part of the population that we're intending to work with. Technical assistance. Again, it's basically the same team I just showed you. We have the Wichita State University Community Engagement Institute, and then we have the Public Health Law Center and Innovation Network. The technical assistance will provide facilitation, leadership development training, coalition development assistance, cross-community learning environment, and project management. So the CEI will be providing those services. Public policy analysis and development will be Public Health Law Center. That's their expertise. They'll provide that. Comprehensive evaluation to learn how to best invest in improving the health of those suffering from health inequities. And then we're going to be convening an advisory committee that's really going to be looking at how we engage deeper the community and economic development sectors, the local philanthropic sectors, and the public health sector from an advisory council. And that group, we've already formed. We had our first meeting on Tuesday. It's a great group. So we have some national expertise on that group, but we also have a lot of local folks that will help be resources. The Kansas Health Foundation has invested over the years over $50 million working to not only build endowments at local community foundations, but build the capacity of community foundations. So we provide significant dollars to community foundations that are endowed. These community foundations are now, we've worked with 39 over since 2000. And these community foundations are now have endowed dollars, which means they're going to be there in perpetuity. And we're thinking about how we work with community foundations throughout the state of Kansas, and we see this as a key part of that work. And so we're working with some foundations now that are trying to build their capacity around how they do investing in community, and so they're going to be part of that learning process with us. We don't know what it's going to look like, but it'll be a part of a process, and that's why it is part of that learning process that we're going to be working on with the technical assistance team and those communities chosen, and the advisory council that we were working with. So who may apply? Organizations who are tax exempt, typical here for us, 501c3, internal, they can be government. They can represent, hopefully they are representing or engaged with a local coalition or partnership at the local level. We would love to see multiple partners. That's where it works best. That's what we've learned, that there's multiple partners and they do shared work. So when other resources come into the community through that coalition or leadership team, people who receive the resources are those who do the work best. And an example I just gave you was Douglas County engaging an organization that has relationship with a community suffering from health disparities. And many of our communities have done that very successfully. Here in Wichita, it's been done very successfully as well. And then the foundation plans to only fund one organization per community. It's hard to have if you have, so that's why I think it's important to engage with others that might be applying and try to figure out a way that you can apply as a group, figure out a way how you engage with the leadership team. If there is a leadership team there, figure out a way how you might build a leadership team. And this is an open RFP. So basically, the communities that we're working with now, they're not guaranteed. So Any community across the state can apply. There's a lot of communities that have built their capacity around healthy communities through a number of different initiatives that also I'm expecting will apply for this opportunity. So funding determinations, and this is really, I think, outlined very well in the RFP. So when you write your application, make sure you look at those each of those sections and try to make sure you address each of those issues in your proposals. So we would like to see those communities that are applicants have experience in facilitating community conversations around issues important to the community, working with a variety of community sectors and leaders in issues important to the community, and also culturally relevant. So please, try to demonstrate in your application how you can do that or plan to do that. Experience with and a commitment to engage with local and state policymakers. Once issues and strategies are developed, we anticipate that you will need to engage policymakers to make a difference in these communities. Demonstrate familiarity with local data and information associated with populations experiencing health inequities. It is anticipated that some of this data will be available so part of your proposal, you'll see that we ask that question. But then it doesn't require you to already have the answer of what populations, just showing us that you can understand it. And of course, finally, we really want to make sure you'll have to demonstrate that whoever receives these funds has the capacity to actually do the work. So the timeline. Proposals are due April 11th, 2017 at 5 p.m. So it's automated. So at 5 p.m. if you haven't submitted it, it's going to be hard to submit. May 19th, we'll announce the grant awards. July 1st will be the start date. We hope that the community liaison is identified by September 30th. Clearly, it would be great if you can identify and have that person hired by earlier. But the reason we want it by September 30th is that on October 10th through 12th, those community liaisons, all 20 of them, will be in this building going through a You Lead Now training, which is one of the standard trainings the Leadership Center has done and it continues to do monthly here, and we've seen it help make people make progress on these difficult issues. So it's really a leadership development piece. But many of our technical assistance providers are faculty here, so it's a 2.5-day experience. But the experience will continue past that 2.5 days. So the TA providers at Wichita State's Community Engagement Institute, who are also either adjunct faculty or faculty here at the Leadership Center, will help develop a learning process and helping people make progress on both engagement, but then also on making progress on those priorities that are developed after the engagement process. And then the grant ends December 31st, 2020. So you'll see in the proposal that there'll be several sections in the proposal, and this is how they're scored. It tells you how many pages, and these are up to. You don't have to do all pages. If you can be succinct and still answer the question, please do, because we anticipate a lot of applications, and it's easier. So it's easier for the reviewers to review more applications. So the clearly 10 points for the capacity of the organization. We do, as I mentioned, we want to see an organization that's receiving these dollars have the capacity to actually manage the project, the financial piece, And then the health equity engagement piece, higher. We score that higher because we really want, and it describes in the RFP how you will make that argument. I hope it's clear. If not, you'll feel free to call me. And then the leadership team and coalition development. That's also where you'd either describe the leadership team currently or the coalition that you're going to be working with, or you describe and make an argument how you can help build one. It doesn't have to be built before the proposal comes in. It would be great if you already had some contacts and some commitments from some folks that would be willing to participate in your leadership team. But that is scored higher than others. And then the proposal objectives, and that's scored 5. And you don't need a lot of objectives, especially during the planning year, because there's really, it's about engaging people. So what are the objectives you might be doing in that? How do you learn about what population? So how would you go about engaging others, thinking about smart objectives on how to gather that data and identify that population. And then 5 points on the budget. So as long as the budget is clear, it makes sense, we'll score those. And then for any information, there's the data. And all this is also on the website. We will archive this presentation. Right now, I'm wanting to entertain questions. Well, the Health and Wellness Coalition, and right there, Becky Tuttle, you talk to her. Any other? We have a question from someone.
Question from Shelley Bonert. She wanted you to clarify for your record sake. Hold on. Sorry, I'm not understanding. Okay, never mind. She didn't have a question. Thank you.
Okay. Other questions? Yes, Charlie.
Oh, there it is. The last evaluation partner was Innovation Network. Are they going to be the same partner?
Yes. Yeah.
What's their
role? They're providing evaluation for the whole effort. So they'll evaluate the work at the community level and also the overall project goals. We've already engaged them, and we've had some. Like we just had a meeting yesterday with our TA team and talked to them. And then we'll continue to have more meetings. They're going to help us between now and July 1st develop a logic model that will help guide the evaluation effort. But they'll look at how you're making progress and basically how you're making progress engaging authentically with populations, and then a number of different. So they're an outside entity. They've been working with evaluating both our current Healthy Communities initiative as well as some of our other healthy behaviors initiatives. So, and I might add, we have some of our healthy communities here, and I think they've been really helpful to the leadership teams because they provide individual community feedback as well. So they do a lot of interviews. They'll interview the leadership team. They will interview other people in your community. Typically, they'll select several communities at different times to actually go and do site visits and spend time with them so they get a really clear picture of the work in those communities. It's not a gotcha thing. It's about a learning process, and and hopefully people understand that. A lot of people are a little intimidated by evaluation, but it really is about learning. It's learning for you and learning for us on how we can do this work better. And it really helped us inform kind of the structure of this initiative as well. Yes. Can you get the mic? Make sure it's turned on.
Does a county constitute a community?
Yeah, it could be a county. We say town, counties, even a region can work. We've got a lot of regional efforts that have kind of emerged, and so we felt like if a region wanted to apply, that would be good as well. Chris.
Jeff, could you speak a little more to the FTE component of this? You I think indicated that it would not have to be fully funded through the grant. So is the expectation that there's a community match to FTE, or could it be someone who's working on some other policy related work, but they're available on a full-time basis?
As long as they're working on a policy efforts around health equity, I think is probably the key, and make an argument for that in the proposal. Or you can actually go out and try to find a match if you'd like to support the full-time person. Or you could use the $75,000 just to fund that person. I mean, so it's, but what we really are wanting is we want someone who is dedicated. We had some of our communities that, some of the original HCI communities had problems with reporting and budgeting and things like that, and a lot of it was because there wasn't anyone that was perceived as totally responsible for the work. And so we want, not only for the learning part of it, we want someone dedicated to thinking about how we improve health at the local level using a health equity lens. So that's kind of what you really need to make the argument for.
Jeff, just to clarify, I think you said this, match can be brought to the table, but it's not required.
Not required. Not required.
I have a question from Judy Schrock. She wants to know, will similar RFPs be offered next year? And that's Judy Schrock from Friends of Kiowa District Hospital and Manor Foundation.
Right now, we're not planning. This is going to be a 3.5-year project, and so we will probably ride this one out for 3.5 years and really try to understand what the next steps that our community work with would be, kind of like our current HCI work. So in our strategic plan may change in 3.5 years too, but so we'll have to wait probably in the last year to be thinking about how we will work in communities. There's also a desire to really figure out how communities can invest in themselves and sustain the work, and that's actually part of the learning process we're thinking about. And what is our role at keeping this work going? Yes, Charlie.
Jeff, for the last few years, HCI has been focused on healthy eating, active living, and the RFP says this doesn't have to be restricted to that. So can you, I know in our community, in our smaller towns, there's increasing concern around mental health and substance abuse issues. Is that type of topic within the purview of this grant?
What we're saying is that once you've identified a population, engage that population around what are the barriers for the people in this neighborhood, this community, as becoming healthier. Listen to what they say, and if substance abuse comes up, then strategies around substance abuse could be worked on. And so it's really, that's the piece. I mean, so it depends, I guess. It depends on what emerges from the engagement process.
Would you have any guidance in terms of, like, is it more appropriate to try to maintain that kind of open process where we're not walking into it presuming that there's a particular topical area?
Yeah.
I mean, I think it's going to be a little challenging as we've kind of embraced healthy eating, active living as our focus, and we've identified a lot of populations that are affected by those issues. You know, to now say we got to step back and be careful not to presume that topic.
Yeah, I think that's the key. I mean, my guess is when you engage populations that some of that, those are going to be some of the same challenges. I mean, if you really try to drill down to some of the issues around their health. But I think the important part is giving voice to that population. So how do you give voice to that population and then it's not just voice, but then it's power, which means whatever they come up with, work it. I mean, it doesn't mean that you quit working around healthy eating, active living in those neighborhoods as well. It just means that let's work what the issues are that those populations say we really feel like we need to work. Yes.
So in that first year of identification, what issues we want to look at? Is there any TA with information gathering?
Yeah, we'll provide that.
Okay, because that's.
I mean,
one of the big issues is having really population-specific data, especially in low population
right.
area like Allen County.
Right, and I think that's part of gathering the information, and that's going to be part of the individual technical assistance that we need to figure out how to provide each of the communities. So as the community liaison is hired and we start working with the TA providers, that's what we're going to be doing. We'll help with that.
Sometimes that existing data is available. Sometimes it's not, and you have to do a little bit of work on your own to better understand, particularly in some communities, a better understanding of a population within that community.
Yeah, so it's the next couple of steps from available data that really, the answer is interesting and it's there, but it's just one step farther.
Yeah.
Yes, Kevin.
So would you expect in the first year budget that there might even be some funding set aside for engaging affected populations to compensate them for the barriers that it might be present for them to be engaged, like child care and the cost of their own engagement?
Yeah, I mean, that's something that has come up over and over again. And I mean, that's why we've said, if you can be creative around how you fund that full-time person and you can get a commitment from that full-time person, you'll have extra dollars to do some of those things. The other thing that hopefully can emerge is how you might access other resources to actually do that. And so I mean, and we've heard this not only from folks here in Kansas, but we've heard this on a national level where people say, it really works really well if you give those populations resources. The bottom line is we have $75,000 a year, and so being creative about how you do that, thinking about how you might access other resources in your community, that might be part of the engagement we're working with community foundations on. And we have an initiative currently that is really a grassroots residents-led initiative called our Community Engagement Grant. We funded 5 communities/neighborhoods to do that work, and some of those folks are in this room today, and it's been really highly I think successful. What we did add into that, it was only 5 communities. We added in some matching dollars that could be used by those communities as they come up with strategies. So we don't have that in place now. We certainly could explore how we might be working with community foundations to think about how they can engage in this work, and that's part of that learning process I talked about earlier. So we're actively thinking about that. That's really a strategy that isn't communicated as much, I think, in the RFP, but it's a strategy around the learning piece. Yes, Charlie.
So the last time around, the focus was on getting really specific about our policy priority. And I just want to, I guess, clarify if there's the same expectation around the population.
Mm-hmm. Yeah.
So
yeah.
We need to be clear, like which population out of all the different populations that we have.
Through the year, yeah. And people have said that too. Well, what if we have multiple populations? Well, I mean, as a community, as a coalition that is working on healthy, I mean, we see that happening already. You're doing a lot of work in a lot of variety areas that live well. Lawrence, of course, Lawrence and Wichita and in Reno County and Saline County have a lot more resources than some of the rural communities. But it goes back to that same notion: is let's focus on a population for reporting and working on the behalf of the foundation, if that makes any sense. And I think, did you have something? Okay, Valerie has a question from someone on the webinar.
I have a question from Ashley Bevan. She asked, she wrote, we see the ability to finance key services impacting overall health, including food access, housing, education, childcare, and rural health care access, being the largest barrier to health equity in our context. Could an effort to impact social determinants of health by more sophisticated strategies to finance key services be a scope of work compatible with this grant?
That's a big question. Ultimately, I think that's part of the work of the advisory committee around the financing piece, because that's what we're bringing together. We're bringing together the community development sector, the economic development sector, the local philanthropic sector to wrestle with that issue. So that's the broader piece. But what we want to see this work is identify a population in your community, engage that population, and let them come up with the solutions. And I mean, that's really that's the key towards this initiative. And as a coalition, you know, as Charlie just said, we would love to see you working on a variety of other issues. We don't want to limit you. We're not saying don't do other work. What we're saying is we want you to report back to us how you're engaging that. We want to see effective means of engaging those, and we want to see strategies that emerge from those engagement processes. Any other questions? Any other questions from the webinar, folks? Okay. Without any other questions, we'll dismiss. We'll stick around here if anybody wants to talk a little bit off record. Thanks, everybody.